Hello, future nurses. NurseEdScholar here. Welcome to another video about fluid and electrolytes. So today we are going to dive into body fluid transport. So let's get started. All righty, that's out the way. Okay, so let's first talk about diffusion. So think about this. You have a solute, which is a substance dissolved in a solution or a solvent. Okay, so diffusion is this process where the solute molecules spread from an area of higher concentration to an area of lower concentration. But how does this happen? Well, you have a permeable membrane. And this allows substances to pass through without restriction. Now, if the membrane is selectively permeable, it will let some solutes pass through, but it puts a hold on others. Okay. And but you're going to wonder, like, where is all of this diffusion, higher to lower concentration? Where is this happening? Well, within the fluid compartments and between the compartments, if the barrier allows. All righty. So that's a kind of quick overview on diffusion. Let's move over to osmosis. Now, osmosis involves the movement of solvent molecules across a membrane in response to a concentration gradient. So it's where the water or the fluid moves from an area of a lower solute concentration to an area of a higher solute concentration. All right. So it'll move concentrated solution. Okay, so you have concentrated solution is on one side of the permeable membrane, and then a lesser concentration is on the other. And then you have osmotic pressure, which is going to pull the water through the membrane to the side that's more concentrated. So if you have one side that has um, lesser concentration and you have one side that has higher concentration. So basically, one side has less solutes and one side has more solutes. So if you look at it, the side that has more solutes, um, it'll be, let's say it like this. You have one side that's just water, and you have one side that has a lot of sugar on it, making it like, just say, thicker. And so osmotic pressure will pull some of that water over to the side that's more sticky to try to loosen it up. Because it's all about trying to get both sides back to balance. Okay? That's a quick overview for that. Now, with filtration, this is the movement of solutes and solvents propelled by hydrostatic pressure. So look at it as a force driving it from an area of higher pressure to an area of lower pressure. Okay. Now, hydrostatic pressure, hydrostatic pressure, the weight of the solution is critical. So fluids, they'll move out of, let's just say, an arterial end of a capillary where the hydrostatic pressure is higher. then osmotic pressure. And then at the venous end, the osmotic pressure will kind of take the lead and drawing the fluids back in. So then you're like, well, where's all of this fluid going? If there's excess fluid, what happens to it? And that's where these lymph channels come in. They're going to return that leftover fluid and solutes back into the intravascular compartment. And basically, it's just trying to ensure that equilibrium. It's all about trying to get an equal amount of solutes on each side of that membrane. Yes, I know it's a lot and it's a little confusing. So things like this, you're just going to have to memorize. Now, let's kind of recap real quick. Yeah. Right? So filtration is the movement driven by hydrostatic pressure. So picture it as it ebbs and flows of fluids and solutes, always trying to get, an equal balance. Hydrostatic pressure is the force of the solution's weight, and that's directing the flow. Okay. So it's crucial in deciding which way the fluids and the solutes would move, creating that equilibrium. And then you have osmolarity. Now, that's a hard one to say, but basically what it is that it's the concentration of a solution measured by the number of osmotically active particles per kilogram of water. And you'll hear things like serum osmolarity, you'll hear those terms from time to time. Now, you know me, everything is pretty short and to the point. So when it comes to these terms, it's basically just trying to memorize them and try to apply the principles. Luckily for us, we have to understand the terms, but we're basically looking at signs and symptoms of a fluid shift issue, or the electrolytes off balance, what kind of complications that the patient is exhibiting and what could be the cause. But it's always good to understand the components of body fluid. Okay, that's essential for all nurses. So thank you for this overview of body fluid transport. Um, this, this part of fluid and electrolytes is confusing as we move on to different uh, difficulties that patients are going to have or different I can't think of a diagnoses, that a person's going to have. Things are going to start coming together. So just be patient, continue to read, continue to gather information from reading materials in class and then videos like this one to try to put it all together. Nursing is a different language and it's just trying to um, understand it so you can adequately take care of your patients. Okay. So if this was helpful or if this kind of opened up some kind of understanding, I hope it did. Please give it a thumbs up. Um, but until next time, please keep learning. Uh, please stay curious. Okay. This is Nurse Ed Scholar signing off.